Here's a sneak peek into one of NCLEX Bootcamp's brand new readiness tests, which just launched and will predict your likelihood of passing the NCLEX. And this is a farm question, which you know the NCLEX loves, and here we need to figure out which of these labs to review before we give vancomycin. So should we review the white blood cell count and platelets? Well, if the white blood cell count is high, that's just going to tell us what we already know, that there's an infection present, and it wouldn't really affect whether we give or hold the med. Same thing with platelets, not really helpful. This might be helpful to review if we were giving a cephalosporin antibiotic instead, like ceftriaxone or cephalexin, because those can cause agranulocytosis, which would affect your red and white blood cell counts, but not vancomycin. Then the serum electrolytes and glucose level. So the electrolytes are really going to be affected if you're giving a diuretic, because those work by retaining or excreting different electrolytes like potassium in the kidneys. The glucose, that's going to be useful if we're giving insulin or another diabetic medication, but neither of these are that helpful for vancomycin. Then the creatinine and blood urea nitrogen levels. So these are your primary renal function tests, and you should remember that vancomycin increases the risk for an acute kidney injury, and we would see an increase in the BUN and creatinine that would cause us to hold the medication. So this would be useful, but let's consider our last option. The PT and INR. So these are your coagulation tests that are going to help you figure out if you have a therapeutic range on warfarin, but unrelated to vancomycin. So out of all of these, I need to review the BUN and creatinine to make sure this client is not going to be at risk for an acute kidney injury, and we're correct. Great job.